If you're struggling with gastrointestinal disorders in nursing school, I promise you, you are not alone. So in this preview, we're going to break down exactly why this topic trips up so many students, and I'm going to show you a framework to finally get a handle on it. It's a really frustrating feeling, right? You spend hours memorizing all the diseases, the symptoms, the treatments, but then you get to the exam and the questions feel like they're written in a completely different language. Why does this happen, especially with GI questions?
Well, here's the secret. Nursing exams, they're less like a trivia game and way more like a flight simulator. See, they're not just testing if you've read the textbook. They're testing if you can actually fly the plane. It is all about applying what you know to a real person, even if that person is just in a question on a screen.
And this is exactly where things get tricky. Trying to tell the difference between conditions that look almost identical, spotting a life-threatening complication before it's too late, or just figuring out how to apply those textbook facts to a real patient scenario, that is the gap we are going to start closing right now.
Okay, so let's actually put this into practice. We're going to shift gears here from just memorizing stuff to actively applying it. This is exactly what you need to do to pass the NCLEX and, what really matters, to be a great nurse on the floor.
All right, check this out. Here's our first little scenario. You've got a patient with abdominal pain, they're vomiting, and nothing is moving through. Now, a bunch of different GI issues could be causing this, so where do you even start? How do you begin to see the pattern in those symptoms?
The key isn't to just memorize more facts. It's to organize the facts you already know way better. When you use a framework, you stop trying to juggle a dozen different diagnoses in your head. Instead, you start seeing the patterns, and that brings some real order to the chaos.
So let's start by organizing our thoughts. Just like this. Is the problem we're seeing mainly about inflammation? Like cholecystitis, that's an inflamed gallbladder? Or is it a physical blockage, a structural problem, like a bowel obstruction? Just making this one distinction is a huge first step in figuring out what's going on.
Okay, let's get even more specific. A patient gives you this classic clue, pain in their right upper quadrant, and it gets way worse after they eat something fatty. What clinical pattern does that just scream to you?
And boom, here it is. This is a perfect example. That classic pattern for cholecystitis is that right upper quadrant pain connected to fatty meals. Now compare that to something like diverticulitis, where the pain is usually in the lower left quadrant. Recognizing these specific cues is how you go from just guessing to actually knowing. And that's how you nail these exam questions. All right, next challenge. Your patient has melena, those black, tarry stools. Now, that's a huge red flag, obviously. But what does it tell you specifically about where the GI bleed is coming from?
Well, the answer is in the pattern. Melena, those black and tarry stools, points to an upper GI bleed. Why? Because the blood has had time to be digested. On the other hand, bright red stool, or hematochezia, tells you it's a lower GI bleed where the blood is fresh. Knowing this difference is absolutely non-negotiable. Okay. Now we're going to take it up a notch. We're going to connect the patient's long-term history to a brand new, urgent problem. This is where we get into that next level of clinical judgment.
So think about this one for a second. You have a patient with a known chronic history of cirrhosis, but today they are suddenly confused, they're disoriented. What's the life-threatening complication that should be screaming in your mind right now?
Your number one concern here has to be hepatic encephalopathy. Just think of the liver as the body's main detoxification plant. When it's all scarred up from cirrhosis, it can't filter out toxins like ammonia. So that ammonia builds up, it travels to the brain, and it basically acts like a poison, causing the confusion you're seeing. This is a perfect example of connecting a chronic disease to an acute crisis.
So how do all these little pieces fit together? It's not about memorizing random facts. It's about having a system. And that's exactly where the CSRM framework comes in. It's a repeatable way of thinking that you can use for any clinical scenario, just like the ones we've been walking through. Here's the whole process in 3 simple steps. First, you spot the clues, those key symptoms in the patient's story. Second, you connect those clues to identify the underlying clinical pattern. And third, that pattern gives you a direct roadmap to your priority nursing actions. It's a clear path from feeling confused to acting with confidence.
And this framework is so powerful because it's built to mirror how high-level nursing exams actually think. The NCLEX isn't just asking, hey, what is cirrhosis? No, it's forcing you to connect the dots, from the deep pathophysiology to how that patient actually looks and feels, all the way to the critical decisions you have to make as the nurse.
So what's the big takeaway from all this? How does this really change the way you prepare for your exams and for your whole career? The most important thing to understand is that this whole approach is about so much more than just one topic. It's not about memorizing a list of facts about GI diseases.
No, it's about completely rewiring how you think. It's about training your clinical eye to see those patterns, to think like an experienced nurse, and to recognize how these textbook conditions actually show up in a real, complex, and sometimes pretty messy patient scenario.
And really let this one sink in. At the end of the day, both on your exam and at the bedside, the right answer, the right move, it always comes down to your ability to accurately interpret the person right in front of you.
This was just a quick look at the method. The complete, in-depth framework from mastering not just GI, but all the major nursing topics. It's all waiting for you inside the platform. It's time to stop just memorizing and really start understanding.